Welcome to the Exploring Healthcare info session, and I'm going to switch to Japanese to introduce myself. So, 皆さん、改めてこんにちは。VIA の医療プログラムを担当している山下里奈と申します。名前の通り、日本人なのですが、父の仕事関係で何度も引っ越しをしました。まずは、ロサンゼルスで生まれて、3歳の時に東京に引っ越しました。そして8歳の時にシンガポールに引っ越し、シンガポールには3年間住んでて、シンガポールアメリカンスクールに通いました。そしてその後にまた東京に戻り、6年間アメリカンスクールインジャパン、調布市にあるんですけども、そこに6年間通ってました。そして高校3年に上がる直前にフィリピンのマニラに引っ越して、インターナショナルスクールマニラから高校を卒業しました。でその後にオハイオ州に移り、オーバーランコレッジという小さいリベラルアーツ大学で生物学と環境学を専攻しました。でその後にボストンに移り、ハーバード大学で教育学の修士号を取得しました。でその後に3年間、Primary Source という小さい NPO でグローバル教育を推進している NPO なんですけれども、教育者の教育に携わる仕事をしていました。でその後にカリフォルニアに移り、3年前にUniversity of California Davis、カリフォルニア大学デイビス校から教育学の博士号を取得しました。でそれから2017年以来、VIA という NPO に勤めています。でこのようにいろいろなところに住んできたゆえに、国際教育、グローバル教育の大切さを実感していて、プログラムの参加者の皆様の視野を広げること、そして物事を俯瞰的に考える力を育むことを目的としています。それでは VIA という団体はどういう NPO なのか、これから短く説明していきます。ここからは英語に切り替えますが、質問などがありましたら、チャットボックスに入力してください。質問は日本語でも英語でも構いません。Because of my father's work, I moved around a lot growing up. So I was born in Los Angeles, and then I moved to Tokyo when I was 3, and then moved to Singapore when I was 8 years old, and then returned to Tokyo in 6th grade, so when I was 11 years old, and I attended the American school in Japan there. And then I finished high school in Manila in the Philippines. And then I moved to Ohio and did my undergraduate studies at Oberlin College, which is a small liberal arts college. And I majored in biology and environmental studies. And then I moved to Boston and received my master's degree in education at Harvard University. Then I worked for 3 years at a small nonprofit organization called Primary Source, where I was teaching teachers and doing professional development related to global education. Then I moved back to California and received my PhD in education at the University of California, Davis. And then since 2017, so for the past 3.5 years, I have been working at VIA, which is a nonprofit organization based in the San Francisco Bay Area. So that's a little bit about me. And so as you can see, I've moved around a lot and lived in different places. And as a result of that, I am very committed to international education and interested in cross-cultural exchange. And as a program director at VIA, I aim to try to increase students' understanding of the world and also introduce many different and diverse perspectives into the programs that I run. So about VIA. So VIA is a small NPO that was founded at Stanford University in 1963 as Volunteers in Asia. So Volunteers in Asia sent American students to Asian countries to do volunteer work in different Asian countries. But starting in 1977, we started programs for students from Asia to visit Silicon Valley and the San Francisco Bay Area. So ever since then, we changed the name to VIA, since we no longer just send volunteers to Asia. And so since the 70s, VIA has been bringing American students to Asian countries and Asian students to the United States. And so we are currently based in the San Francisco Bay Area, and we have 7 staff members and over 10,000 alumni all around the world from our various programs. And we have programs not only in the US, but also Indonesia, Japan, Myanmar, Thailand, and Vietnam. So today, the program I want to tell you about is the Exploring Healthcare program. But before that, I would like us to do an icebreaker. And this is also meant to model what you might experience during the program itself. I know that all of you are probably getting tired of lectures and discussions through Zoom. And so during this program, we will make every effort to make it interactive. And we will do that in part by doing icebreakers. So for today, what I'd like us to do is to please share your name, your current location, so where you're living, and your hobby. And we're gonna do that through using something called Padlet, which is a virtual whiteboard. So I'm going to share this link to you in the chat box. Let me just demonstrate what this looks like. So when you open it, you'll see something like this. And so you can press this plus button here, and you can say, so my name is Lena, and I am currently based in the San Francisco Bay Area, and my hobby is latte art. Okay, so please go ahead, and if everybody can put in your name, your current location, and your hobby, that would be great. Okay, so during the program, we will use a Padlet, this platform, to do icebreakers and other platforms too. So I hope that this gives you a flavor of what an icebreaker might look like during the program. So thank you everybody for sharing. It looks like there's many exercise, sports-based hobbies. That's great. Okay, so for the sake of time, I'm going to go back to the slideshow. So, okay, so that was our quick icebreaker. So now I'm going to tell you about the actual program, the Exploring Healthcare program. So Exploring Healthcare. I first want to tell you about the goals of the program. One of the goals is for participants to critically examine healthcare systems in the US and Asia. And you'll get to learn about health insurance as well as part of that. Another goal is for participants to broaden awareness of unique medical issues faced by patients from diverse backgrounds. And although the program will be held online, many of the healthcare professionals that we invite and the issues that we will delve into deal with diversity, and the San Francisco Bay Area is a really great place to study various medical issues faced by patients from diverse backgrounds. Another goal is for participants to explore the intersections of healthcare and social issues. And we are currently in the middle of a pandemic, and so COVID-19 will be used as a special lens to understand and explore related healthcare and social issues. Another goal is for participants to gain insights and mentorship from a wide variety of healthcare professionals. And so I think all of you are medical students, and certainly physicians are very important healthcare professionals, but there are also other healthcare professionals such as nurses and social workers and other types of workers who together help provide high quality care. So during the program, we will invite a variety of healthcare professionals and hear and learn from their perspectives. And finally, we want participants to determine what kind of healthcare professional you want to be and expand your network. So these are the 5 goals of the program. So the dates, again, are from March 21st through the 27th. This is Japan time, Japan dates. And so a day of the program might look like this. So in the morning, we will have a guest speaker or panel discussion or an interactive workshop. And then in the afternoon, you will have some group work and discussion with fellows. I will explain who fellows are in a moment, and some time for individual reflection. And then in the evening, you'll share your reflection on Crew, which is an online learning platform, which I'll say a little bit more about later. So this is the overall flow of what a day might look like. So morning session. So of course, this will be all done via Zoom. So you'll see something like this. And then I also wanted to say a little bit about the guest speakers and panel discussions. So who might they be? So the speakers and panelists may include current medical students at Stanford and other medical schools. So although you can't meet them in person, you'll certainly be able to meet them via Zoom. And they're excited to have conversations with you. Former EHC fellows. So fellows are either alumni, so people who have participated in the EHC program before, or American medical students, and they help facilitate the program. Other guest speakers and panelists will include organ recipients and family members of organ donors. So maybe some of you are interested in organ transplantation, in which case this program will allow you to hear the experiences of organ recipients and family members of donors, as well as a variety of healthcare professionals from doctors to nurses and social workers. So these are just a sampling of the guest speakers and panelists during the program. I also wanted to say a little bit about the different healthcare topics that we'll be exploring during the program. So medical education, organ transplantation, mental health, palliative care or end-of-life care, health disparities and complex social challenges, the role of media and differing cultural values on healthcare, and post-COVID-19 healthcare. So what might healthcare look like after this pandemic is over? And as I mentioned earlier, we'll be using COVID-19 as a lens to really explore different healthcare challenges and social challenges, and take a step back and really use COVID-19 as a learning opportunity to delve deeper into the complex social challenges. Okay, so before I say a little bit more about the program itself, I want to do another icebreaker. And so what I am going to do in a moment, or what Melissa will help me do, is to split you into breakout rooms. And in that small group, I would like you to discuss what healthcare topics are you interested in? And it might be one of the healthcare topics that I mentioned earlier, but you might have other interests too. So in a moment, you'll be placed in a breakout room. And so please take a few minutes to discuss this question in your small group. And when you are in your breakout room, please unmute yourself and turn your video on. And I also want to thank the 3 of you for being brave and sharing. This is great. And so for the sake of time, I'm going to move on. But during the program too, I invite all participants to be brave and share their reflections and thoughts, because the more participants share and share opinions with each other, the more interactive and more enjoyable this program will be. So with that, I'm going to now say a little bit about fellow groups. So I mentioned this very briefly earlier. So fellows are previous alumni or previous participants of the EHC program, and they will facilitate these small group discussions, so fellow groups. And there will be about 3 or 5 of you per group. And so basically in this small group, you'll share ideas and reflect on the day's activities. So as I mentioned before, in the morning, we will have guest speakers or panel discussions or workshops. And for that, we will all be together, all participants. But then in the afternoon or evenings, you'll be put in these smaller groups where you can share what you learned and reflect. And this is also an opportunity to practice speaking in English in a small group setting. Now, I know that in a large group, even if it's online, it's very intimidating and scary sometimes to speak English. But in these smaller groups, it'll give you a chance to build your confidence with speaking English. And in these groups, you'll also create a resource together on topics of your choice and share with other groups. And if you decide to join the program, you'll learn more about what this means. But we hope that these resources you can use even after the program, that you can continue to build on. And so hopefully that'll be useful. Okay, and then, so the online platform. So the platform name is called Crew. And so this is what you'll see when you log in. And this is where we'll share information about the schedule. This is where we'll be sharing resources. And there's also a discussion forum where you can comment on each other's posts. And so we will be using this discussion forum to make this program as engaging as possible. Okay, so a little bit about logistics of the program. So the dates of the program are March 21st through the 27th, and this is Japan, the Japan dates. The fee is $900 US, and what this fee includes are 15 plus hours of live online presentations, discussions, and interactive workshops, guest speakers and panelists representing a variety of healthcare fields, and access to the online platform. So this program might be right for you if you have a busy schedule and you're looking for something with less time commitment and more flexibility than an in-person program. An in-person program is packed, and it really requires a lot more time. But if you have a busy schedule, this program might be right for you. This program might be right for you also if you want mentorship from peers and a variety of healthcare professionals without traveling far. If you want to discuss a variety of healthcare topics, including COVID-19 related social issues and current events. And if you want to form friendships across cultures. And finally, if you want to practice English in formal and informal settings. So as you think about if this program will be a good fit for you, consider these reasons. And if one or more of these reasons appeal to you, I would encourage you to apply to this program. So the timeline is as follows. So the deadline is January 31st, and you'll be submitting it online. And then in early February, or during the first 2 weeks of February, you'll be invited to an interview with VIA staff via Zoom, about 20 minutes, and this will be done in English. And then by February 15, results will be announced. And then February 21st, if you decide to join, then you'll confirm that. And then in early March, there will be a pre-program orientation. So what I now want to do is to turn to one of our alums, Tomomi, who joined the EHC program in spring 2019. So just to clarify, Tomomi participated in the in-person program, so she did get to visit San Francisco. This time it will be online, but there will be many components that are similar between the in-person program and the online program. So I'm going to now invite Tomomi to share about her experience with the EHC program. So I am going to stop sharing my screen, and Tomomi, you're welcome to share your screen when you're ready. Great, thank you, Tomomi. Now we see your screen.
Hello, my name is Tomomi Nakame. I'm a fourth year student of St. Marian University School of Medicine. I would like to talk about what I experienced during the EC program, which I participated in 2019. These are the photos of San Francisco. And we learned about healthcare in San Francisco and learned about the topics like LGBTQs and homelessness. We visited Stanford University and we listened to the talks of Stanford University's doctors and had some panel discussions and had a chance to talk with Stanford medical students and went to Stanford Hospital. This is the photo which was taken at Stanford. Dr. Pompey told us about medical education. The guy who is asking question is me, and but at the first time I was very shy to speak English to others. However, I decided to be active, brave, curious, and open-minded during the program. So I raised my hand and asked him some questions. It was a big change for me. These are the photos which I took with the guests of panel discussions. The topics were mental health, work-life balance among physicians, palliative care, and organ transplantation. On the right side of the photo, you can see Dr. Mita Rai, who's an emergency physician of Stanford University, and also she raised her daughter, so she emphasized the importance of work-life balance. In the left side of the photo, you can see the woman. She's a real recipient. I was very surprised because some of the guests were real recipients and real donors' family. I think it's a good opportunity to speak with them and listen to their stories during the organ transplantations panel discussion. These are the photos which I took with fellows and fellow groups. The fellows were Angelina and Yuka and Shichi. Angelina was from United States and Yuka and Shichi was from Japan. All of them were so kind and very reliable fellows. So they help us all the time when we need help during the class or discussions. We were divided in 3 groups, fellow groups, and every day each group had a meeting for reviewing and share what we learned or what we experienced to others. It was a good time for us to get to know each other and we get used to speak English. I had this fantastic time in the ESC program. It was a good opportunity for me to break out my shell. This time, this program will be held online. However, it'll be a good chance to learn healthcare and speak English. Also, EHC staffs are so kind and supportive. So I strongly recommend to participate in this program. Thank you for listening.
Thank you so much, Tomomi. I really appreciate your sharing your experience. So we heard from Tomomi, and So I hope that her perspectives encourage you to consider applying to the program. And as she said, this time it will be an online program, but you'll still be able to form friendships and have discussions and learn about healthcare topics and really delve deeper into COVID-19 and using that as a lens to explore healthcare issues. So with that, that concludes the formal part of today's information session. Does anybody have any questions right now? One of the questions I did get in the chat just now that I thought maybe everybody else could benefit from too is there was a question about homework or any sort of reports that need to be written during the program. So the answer to that is there will be one short reflection paper that you will be writing, and this will be in English, but hopefully that'll give you an opportunity to take a step back and reflect in writing what you learned through the program. But there will not be daily homework per se, but you will participate in daily discussions and there will be learning and interaction. So that was a good question. Does anybody else have any questions right now? If so, please do type it in the chat box. If not, if you don't have questions now, but other questions come up later, please do email me at lena@viaprograms.org.